Day.
Welcome back to the Senate Committee on Government Operations meeting of Wednesday, February 19th. We are going to take some testimony on S53, which is an act relating to certification of community-based perinatal doulas and Medicaid coverage for doula services. And we're very happy to welcome into the committee the sponsor of the bill, Senator Martine LaRocque-Kulik. And you know everybody here, so we don't have to walk around the table.
I do.
Welcome.
Thank you so much, Chair Palmore. For the record, Senator Martine LaRocque-Kulik, happy to be here today to talk to you briefly about doulas and S53. I will start by just giving you a quick overview of what a doula is, because a lot of folks don't know what a doula does and what their role is in our healthcare landscape. They're actually non-clinical people who help a birthing person and family navigate the process of giving birth. And it starts with, prenatal health all the way through the birth, no matter how long or short it is, and then postpartum care as well. And that was a big piece that I learned about last year that hadn't really resonated as much with me, but how important they are around postpartum care. A lot of folks struggle in that period of time for a variety of reasons, and doulas, and there's a ton of data, by the way, to support everything I'm saying. Doulas are really helpful in helping folks navigate the emotional and psychological stress of having a baby or babies, as it were. So, but again, there's a lot of great data around this, and I would be happy to share it with you. Last year, we passed a bill that became law, and there's a great doula sunrise report that I would recommend you all take a look at for your own edification and understanding of the process that OPR went through to get to this point of trying to figure out how do we regulate doulas so that Medicaid can support them in their work and support families be able to access doulas in the state of Vermont. Senator Clarkson, did you have a question?
No, I just wanted to hope that we have the sunrise report or will on our website.
Yeah. I won't.
But I was going to restrain myself and wait till later.
No, but you bring up a good point.
And send it to them.
Yeah.
It's so loaded with great information, everything from the role of doulas in maternity support to some great data around how they save money, because that is a big part of this. It's not just the health and the satisfaction and well-being of the family or the birthing person, but also the fact that they actually save our system so much money by avoiding low birth weight babies, by avoiding cesarean sections and other unnecessary medical interventions. So that is, so I would recommend that. But in the end, what the Sunrise report talks about, and I know that Jen Harvey will speak more to this, is just that they should not be certified, that they should be regulated and certified, but there are areas that I will just read it. OPR doesn't recommend licensure. They don't recommend registration, but they do recommend voluntary certification. So, and that is where OPR is needed to continue the work. But that voluntary certification would really allow the community-based doulas, and community-based doulas are a little bit unique because they really provide services to our most vulnerable. So we would really be targeting, funding and resources to our most vulnerable folks in the state. And I think those are the big pieces that I wanted to bring up today.
Senator Clarkson.
Thank you for bringing this. I would love to know the difference between a doula and a midwife.
Okay, a midwife is medically trained. whereas a doula is not.
So why would one use a doula instead of a midwife? Because my understanding is midwives do many of the same things that you've discussed.
So I am a really great example. I had a midwife and a doula. And the reason that I chose to have both, so the midwife really does the work that a doctor or OBGYN doctor would do. So the medical piece of assisting in a birth. A doula is really there for support, psychological support, emotional support, around the clock. Like they are there from start to finish. They don't leave, they don't go on break, they are there with you. And because there's this continuity from, months before you give birth, through the birth, and then postpartum, you just develop this relationship and this sense of trust and comfort that is hugely important in the birthing process. And we were given an example the other day in committee of, you heard it, but if you're in the wild and we use the example of a gazelle is giving birth and they're suddenly startled by a predator, their hormones start acting up and the birthing process stops, until they get into a quiet, safe space where they can give birth again. Human beings are not dissimilar, right? If we're in a hospital and there's a lot going on, there's a lot of stress and people coming in and out of the room, we're not in a position to be comfortable in the birthing arena, at least not all of us. And a doula is someone who really helps keep the atmosphere calm, keep it stable, consistent, and so on. And that's why you have lower levels of intervention and complications with birth.
And better outcomes afterwards.
And better outcomes, absolutely. Again, lots and lots of data for you.
Do we know how many doulas there are in Vermont?
No. Jennifer Carvey, legislative
Not
counsel,
regulated.
no, because they're not regulated.
So without asking an inappropriate question, how did you find your doula?
It's a really good question. I believe I met her through a birthing class that I was taking.
Okay.
And she was there and she probably presented at one of our classes and we connected and there you go. That was it. She assisted at both of my births. Yeah.
So just to be clear, this committee is charged with deciding about the certification as referenced by Senator Gulick with the OPR Sunrise. We will send this bill back to Health and Welfare to deal with the Medicaid implications and
Right. Yeah, I know. I wasn't sure if I should even go into that, but I thought it was important to have a little bit of a context.
no, and I appreciate that, Senator, I really do, because I would have, as Senator Clarkson said, if somebody asked me, if anybody went on the street, hey, what's a doula anyway? I would have said a midwife, basically, but you've made the clear distinction that they're two different occupations, they're two professions. Yes, Senator Clark.
So what is the cost difference for a person, a low income, because you talked about the importance of this with being able to be eligible for Medicaid,
Yeah.
but would a low income person actually be hiring two different people to help them with a birth as opposed to one?
So are you asking what the cost?
Yeah, what
of
is the
doula
cost
is?
difference between having, what's the cost of having a doula, a midwife versus, and a doctor? Do we have a cost comparison of all three of them?
I don't have one right in front of me. I know doulas tend to be very inexpensive, and when they gave testimony last year, I mean, it was a range from some doing it basically pro bono to a few $1,000s and everything in between, but maybe
And
Jennifer.
then, well, they're gonna hear testimony, they're
Okay.
gonna hear from one of the
Okay,
let's
that's
justify that.
Okay, great, because I think if we're talking about saving money, that's great, and I appreciate all the aspects, or many of the aspects anyway, until we've had the testimony, many of the aspects of how a doula might help save our medical system money. And I
Yes,
appreciate that. I just, as you talk about low income people being eligible, like, would they actually be thinking about hiring two people?
Yeah.
To help through births?
right. Yeah, no, there's a lot of great data around cost savings.
So everybody else.
Well, so that was sort of some of my question, that maybe for you, Senator Gulick, or maybe for the committee, but I do wonder if we're going to hear from the PR and JFO. And if JFO look at some of the potential cost savings. And to me, it's sort of a holistic view of, the traumas of living life in certain places in the world and how that may make you more likely to have a really challenging time. And therefore the increased importance of that extra support, and not only looking at, oh, well, is it cheaper to hire a midwife and a doula than it is to give birth in a hospital, but also across the course of a lifetime, the potential decrease in the need for early intervention and all of those other aspects. So I hope that there is a kind of broader view. And I know you did this a lot in your committee last year. So I guess my question for you is there any look at those sort of longer term, both social and economic impacts?
Yeah, I mean, as you know, JFO is always a little reluctant to sort of to extrapolate some of this information. So that isn't something that we necessarily got per se, but there is, like I said, so much data around the millions and millions of dollars that are saved from avoiding preterm births and avoiding C-sections. And it's just a huge amount of money, because, I mean, as I like to say, being pregnant and giving birth it's not a disease. So sometimes when you go into the hospital, you're automatically seen as someone who is, sick and needs either like an operation or like some pretty serious intervention. And that's not always the case, especially for a low risk pregnancy. It's a natural function. I don't know if that answers.
It helps, but I imagine that even more so in higher risk pregnancies, you would want this type of support and this type of care to mitigate stress. And like that stress has a long-term impact on the parent, the child, and that relationship and bond.
Absolutely. Right. Yes.
Okay.
You're absolutely right. And I will leave this with you. I'll give it to my colleague right here, just to take a look at that. But yeah, there again, whatever data you need, happy to give it to you. I really appreciate you all taking the time to take this up and to give it serious consideration, and look forward to hopefully it making its way down the hall and talking about it some more.
I did have just one random
certainly.
question around this is not there. People say doula and they also can say death doula.
Mhm.
Does this have any implications on death doulas?
Only
what
a death doula is, is someone who also, I don't believe is medically trained, but helps someone transfer
Yeah.
from one stage to another stage of life. And so again, just having that friend in the room with you as you're experiencing whatever it is you're experiencing.
But those are not the same.
Totally
Okay.
different. Very
One
different.
doula is not.
Yes.
You have a doula for all, I guess.
Would this certification apply?
No,
Yeah,
this was not contemplated in
Oh, okay.
legislation at all.
Perinatal.
Yeah, just perinatal doulas.
Yeah, we have a lot of
Community-based
hospital
perinatal.
birth, it feels like.
Well, we don't mean to keep you from your other
Oh,
important
right, well,
work.
this is fun. I want to come back again.
You're always welcome, Senator.
Thank you, Senator.
Anytime you need
Much
a break
appreciated.
from finance,
I
just
think I'll just
right
come across the hall. Thank you so much. And I look forward to hearing about the rest of the
Okay.
testimony.
Martine, I'm sorry. You're sending this to.
Yeah, sure.
I think Jen is sending.
No, I sent a report. I sent an OPR report. That's all. I sent.
that's a different document.
Right, it's a different document.
Martine's.
Yes,
Did
I'm
you
gonna send
me-
you so much data, it's gonna make your head spin.
Right.
It's just gonna be
Good.
lots of lots. Thank you.
Jen, do you want to join us?
Yeah.
Please.
Oh, and JFO's here, so.
Oh.
Didn't quantify everything.
Just making sure you stay in
Well, do
line.
you know everybody?
I do, thank
Good.
you. Yeah.
Wonderful.
Good afternoon, Jen Carvey from the Office of Legislative Counsel. Are you a put language up on the screen committee or a follow along?
We have the bill.
We have it, right. Okay, so I wanted to take a step back a little bit as Senator Gillick did and just talk a little bit about what happened last year that prompted this bill. So there was a bill, actually companion bills introduced in the House and Senate last year to require Medicaid coverage of doula services. And it became clear that there wasn't an entire agreement around what type of training would be appropriate for doulas to be participating in the Medicaid program, and the Department of Environmental Health Access felt like there needed to be some sort of a stamp of approval before they were comfortable attaching Medicaid coverage. And so the decision was made to direct the Office of Professional Regulation to do a sunrise review to deem the protection, the need for protection of the public standard to be met, and to figure out which of the three options, licensure, certification, or registration, was most appropriate. And so that's the OPR report that Senator Gulick recommended to you, that Jillian has the information for. And it also, that same act, is Act 97, also directed the Department of Vermont Health Access to come back to develop and include as part of their fiscal year 2026 budget proposal, which they have done, a proposed methodology and determine the estimated costs if Medicaid were to provide reimbursement to qualified doulas for providing their services to individuals covered by Medicaid, and specifically to provide DVHA's proposed reimbursement methodology for an estimated costs of providing Medicaid coverage for doula services, a recommendation for whether doula services should be covered by Medicaid. If doula services are covered, ways to recognize the potentially beneficial impacts of doula coverage on Medicaid spending over time, which I think is some of the question you were asking. And then information about whether Vermont would need to get a Medicaid state plan amendment in order to cover doula services. So they have provided a lot of that information. I'm not sure, at this point, I'm not sure anyone is necessarily able to capture the potentially beneficial impacts on Medicaid spending over time. There's a lot of, that's fairly speculative, and I think there's a lot of other factors that may account for various things, but there is recognition that that may have a beneficial impact.
Jen, I just sent the link to that report, the community system proposed,
Sure.
Which report?
the D one,
Okay. It's on page
54.
54. 130 pages. The DVHA budget.
Very helpful.
So-
Specific citing.
That brings us to S53, which is an act relating to certification of community-based perinatal doulas and Medicaid coverage for doula services. This bill would add a new chapter in Title 26. It's Chapter 84, which I put in right before the licensed midwives. So just a pause for a moment there to recognize there are two types of midwives in the state as well. There are licensed midwives, what people sometimes refer to as lay midwives. And then there are certified nurse midwives, which is one of the specialties that an advanced practice registered nurse can focus on. So we have two different types of midwives, and then this separately is the non-medical doula. So we have, yeah.
Can you just, so there's three things here, and I'm trying to distinguish certification, registration, and licensure. And is there sort of a difference as you go up?
Hierarchy.
Yes.
Yes, as I understand it, and a lot of this information is in the Office of Professional Regulations report, but licensure is kind of the highest level of regulation. And part of the sunrise review, I believe, is to identify the least restrictive form of regulation that's appropriate for the protection of the public. And so they go through all of their levels, but licensure is the most restrictive form. It mandates, I'm reading some from the report right now, but it mandates qualifications for all professionals prior to practice. There's often formal education requirements and testing and experiential requirements. Also, there's registration, which is the least restrictive form. It requires no education or qualifications. It really just requires the individual to notify the Office of Professional Regulation that they're going to be practicing in a profession and pay a fee. So certification is the middle range.
Oh, see, I thought it was the least.
No registration, which
Okay.
is what we did with contract. Registration,
Registration, certification,
certification,
and license.
licensure.
Okay. Thank you.
Sure. All right, so in our new chapter, we start off with definitions, and some of them kind of feed each other, but they're, I think, helpful to get a picture of who we're talking about. So as used in this new chapter, a certified community-based perinatal doula is a community-based perinatal doula who holds a certificate issued pursuant to this chapter. I'm not giving you a ton of information. Yeah. A community-based doula is an individual who provides doula services to under-resourced and marginalized populations at low or no cost, often through a community-based agency.
sort of like a community care nurse or a community care coordinator. I mean, just happen to focus on babies.
Yeah, well, I will let our representative of the profession speak about that. A community-based perinatal doula is a community-based doula who provides doula services to individuals during the perinatal period. Director is the director of OPR. Doula is a non-clinical, non-medical individual who provides direct emotional and physical support and educational and informational services to birthing individuals before, during, and after labor and childbirth. And finally, perinatal is the period of time that encompasses pregnancy, childbirth, and up to 1 year postpartum.
Okay, that was my big question.
Yeah,
I was
so
like,
once you get
what
to the
is-
end, yes.
Yeah, I was like,
And
what is
period is
perinatal?
just like around, so it's sort of
From the
around.
Latin peri, which means surrounding.
Exactly.
Oh,
Exactly.
because I know, I was like, I knew prenatal and postnatal,
Exactly.
perinatal.
Perinatal is kind of the whole, that whole thing.
And up to 1 year
And
postpartum.
up to
It's
1 year.
very useful.
That's, okay.
I think it's very
All
useful.
the time.
All
Talking
right,
about how useful Latin is.
Is that the first time that's gonna be defined in?
Perinatal?
Yeah,
probably.
that is really cool.
I'm not sure I'd have to search it, but, all right, so then we get.
Unless you
into-
wrote it, my dear, you would have written it. So, you know.
We get into prohibitions and penalties, so nothing in this chapter, so this is a little different from some of our professions that we regulate. Nothing in this chapter should be construed to prohibit the provision of doula services by a non-certified individual, provided that no person shall use in connection with their name any letters, words, or insignia indicating or implying that they are a state certified community-based perinatal doula unless they are certified in accordance with this chapter. And we have our usual OPR violation provisions. So you're still there. There may be non-certified doulas continuing to provide services as they do today. The difference would be that they would not be necessarily paid under the Medicaid program. So this is part of this is a pathway to Medicaid coverage. All right, then on page 3, we have the duties of the director. This is similar to other certified professions. The director, meaning the director of the Office of Professional Regulation, shall provide general information to applicants for certification as certified community-based perinatal doulas, receive applicants for certification, grant and renew certifications in accordance with this chapter, and deny, revoke, suspend, reinstate, or condition certifications as directed by an administrative law officer, explain appeal procedures to certified community-based perinatal doulas and applicants, explain complaint procedures to the public, prepare and maintain a registry of certified community-based perinatal doulas, administer fees collected in accordance with this chapter and the fees section for OPR professions, and refer all disciplinary matters to an administrative law officer established under the OPR statutes. And it allows the director, after consultation with the advisor appointees, which we'll see in a moment, can adopt rules as needed to perform the director's duties. Then we have the advisor appointees. Secretary of State will appoint 2 certified community-based perinatal doulas to serve as advisors in matters relating to these community-based perinatal doulas. They will be appointed as set forth in the OPR statutes and serve at the pleasure of the secretary. One of the initial appointments can be less than a full term, so they're staggered appointments. Appointees shall have not less than 3 years' experience providing community-based perinatal doula services immediately preceding appointment and must be actively engaged in delivering those services in Vermont while they are serving in that role. Directs the director to seek the advice of these advisors in carrying out the provisions of this chapter and gives the advisor appointees per diem compensation and reimbursement of expenses at any meeting that is called for the director for the purpose of seeking their advice. We have eligibility. To be eligible for certification as a certified community-based perinatal doula, an applicant must complete and submit an application in the manner prescribed by the director by rule, accompanied by the applicable fees and evidence satisfactory to the director that the applicant is at least 18 years of age, has sufficient and appropriate competencies in community-based perinatal doula services, whether acquired through experience, mentorship, training, formal education, or a combination, as determined by the director by rule, and they must have passed any criminal history background or registry checks required by the director by rule. The certificate can be renewed every 2 years. Payment of the required fee is required along with the application and proof of compliance with any continuing education or demonstrated competency requirements established by rule. Unprofessional conduct, misusing a title in professional activity, and any of the conduct listed in the OPR statutes, whether committed by a certified community-based perinatal doula for an applicant. And it allows OPR to discipline someone for unprofessional conduct as set forth in OPR statutes. Speaking of the OPR statutes, on page 6, we get into some kind of conforming changes to add this profession to throughout some of the OPR statutes. So as far as in section 2, the boards or professions that are attached to the Office of Professional Regulation, this adds community-based perinatal doulas. Section 3 is the list of professions for which OPR can inquire into criminal background histories. Again, adding community-based perinatal doulas. Section 4 is the fees. So this would establish fees for doulas with the initial application for certification would be a $75 fee, and then the biennial renewal would be $120. So these are a little less than some of the professions, and these are the fees recommended by OPR.
My questions, I realize is actually for OPR, so I will not make you answer for them.
Okay, great. Section 5 is where we get the Medicaid coverage. So it uses the same definition of certified community-based perinatal doula that was established in that new chapter. Requires the Department of Vermont Health Access to provide reimbursement to a certified community-based perinatal doula for providing direct emotional and physical support and educational and informational services to birthing individuals covered by Medicaid during pregnancy, labor and delivery, and the postpartum period. And language specifies regardless of the outcome of the pregnancy. And it also specifies that a certified community-based perinatal doula cannot receive reimbursement for their travel time or mileage expenses. Section 6 provides some legislative intent, which may get turned into something more specific, but around the legislative intent that DVA reimburse qualified doulas in amounts that are reasonable and adequate for the services provided and are consistent with reimbursement rates set by other states' Medicaid programs. This is some language that had been in the bill at one point last year. Directs DVA to seek a state plan amendment if needed, and according to DVA's information in their budget proposal, they do need, we would need state plan amendment from the Centers for Medicare and Medicaid Services to allow the state to provide coverage for doula services. And then Senator
Clark.
So, given the friendly feds at the moment, supporting all new cutting edge medical opportunities, how do you think how likely is that to happen?
Forecast that. I mean, I know
We can only do what we can.
right. We can ask, we can pursue our normal
Plow on.
processes.
Senator Wade.
Thank you, Mr. Chair. Just to be clear, basically after section 4, that's kind of,
It's mostly
it's
down the hall.
okay. So
Both directions.
I'm not gonna ask any questions about 5 or 6, or do I even have a section 7? It's 7. 5,
Sorry, that's fair.
or 8. I'm gonna,
So section 8 is the effective dates. It would have the certification program under OPR take effect on July 1st of 2026, but have the director of OPR commence the rulemaking process before then in order to ensure that the rules will be in effect when that certification starts. Section 5, the Medicaid coverage would take effect on July 1st, 2026, or upon approval of our state plan amendment, whichever is later, and everything else takes effect on passage.
Senator Claxton, did you have
Whatever.
Okay.
The entire, I mean, yes, we're certifying doulas, but without the feds acting, Becca, there is no Medicaid support.
I completely understand that.
Okay.
I think what I'm just trying to say is like, I'm
It's
gonna let
moot
health and
for us.
welfare.
Yeah,
Yeah,
that's their.
It's their
I
jurisdiction.
could ask so many questions about that.
No, I know.
So I have one back on page 4.
Yes.
The question I had earlier was how many doulas are there? We don't know.
Right, I think generally we don't know because there is no current regulation,
Right.
so there's
There's no
no
net.
reporting.
So-
There's some estimates and you may be able to get some from some of the
Sure.
provider groups.
How would the appointees provide evidence about the 3 years experience if we're not able to identify who they are?
I think they would, I think they would have to be providing that to the satisfaction of OPR, so you may want to ask OPR. But I think there are certainly people, and again, I will defer to the expert in the room, but who have been performing these services for a long time and can probably document that.
Okay. Are there any other questions for Jen regarding our jurisdictional responsibilities here? We can't get into the Medicaid fees here, but
No, but our advisor is going to be an advised profession in OPR. And am I just missing how many advisors there are? Oh, only 2. Oh, so I was thinking that was the beginning. Oh,
I think that's fairly common, but
is it that there are only 2? I always feel like there are these boards with tons of. Well,
that's different. Right, those are not advisor, those are not
There are some
advisor
advisors.
professions. Those are generally boards.
Got it.
Yeah,
Okay.
like I know the social work's got a big board.
Yeah,
But those are licensed, those are next tier.
Exactly.
That was actually gonna be my question, is that sort of one of the distinctions, the small advisory?
Good question. I haven't created enough professions to know, so I think it'd be a good question. for Olivia.
So it's like, if we don't know how many prenatal or perinatal doulas there are in the state, how would JFO, I'm just curious what JFO's guesstimate was in terms of how this would support itself for
If you could.
the Secretary of State's office in OPR, which is having some challenges in terms of loss of fee. So,
Right, I do know in setting the fee amounts that there was concern about not setting the bar high enough to be a disincentive, considering these are providers who are working with lower income,
Yeah.
under-resourced and marginalized populations.
but the doulas themselves may not be lower income.
Right, but I think they're.
Usually
Right.
don't charge very much.
Right, exactly, it may not.
No, I appreciate that, but I'm just curious if we may ask JFO, what was your fiscal note on this? And what do you think it'll earn for for OPR?
I don't give a fiscal note on the bill.
I did not do this for the record. No, I'm not joint fiscal office. I didn't do a fiscal note on. Actually, I might have done something
You would have
last
done
year.
one last year, had money in it, but you wouldn't have done it with these fees in it.
No, I wouldn't have done it with the
This didn't
fees.
didn't exist yet.
But I did do an issue brief on this in 2017. And at the time, I estimated that there was about 40 to 50 doulas in the state. I'm assuming there are probably more because there's been a lot more certifications and it's become more popular since then. And I can send to the committee system. I think some of the issues I raised then are relevant today. For instance, how much money you save over time will depend on how big the uptake is of it. Right? There's all these moving factors.
And that's some of what DIVA is recognizing as well.
Yeah.
Mhm.
Jen, thank you very much.
Yeah.
Excellent job.
Thanks.
Who is up next?
Hi.
Maria?
Sure. Welcome.
No?
How are you?
There's
I'm good, thank you. How are you?
Good, thanks.
Thanks for having me today. So my name is Maria Rossi. I've been a doula for about 15 years. I'm also a social worker, so I'm familiar with OPR from that perspective. I work for Washington County Mental Health, and I coordinate a doula program that's embedded in our mental health agency. So we are a community-based doula program. So I've heard a lot of questions, and I'm happy to answer questions that are particular to what community-based doulas do, and some of the work that we've done over the past almost 15 years. But 14 years ago, with the help of Mary Moulton, our executive director at the time, I created the doula project at Washington County. We provide prenatal, birth, and postpartum supports to our community members who receive Medicaid assistance. And I feel as though my experience running this program allows me to speak to the unique needs of the Medicaid population, as well as the needs of doulas who are serving them.
In the past year, I've helped to co-found a statewide doula organization called the Doula Association of Vermont. And I'm here today representing the Doula Association of Vermont. I can speak a little bit to the doula numbers. I know that's been like a big question, and it is really hard to come up with those numbers. I would say right now this is a really rough estimate, but based on information that we're getting and the way that we're reaching out to people.
And your membership.
Yeah, well, the membership that's a new initiative, so I wouldn't say it's really a representation of who's out there, but we guesstimate around 100 doulas, and there are some initiatives that currently are underway to provide a statewide doula training that has an enormous amount of interest from the state, from people across the state looking to become doulas. So the Doula Association of Vermont really wholeheartedly supports OPR Sunrise study on certifying community-based doulas. The Doula Association was able to work closely with OPR during the Sunrise process, and they were incredibly collaborative in their work. They proactively reached out to us to ensure really robust community engagement. And as a result, we were able to support families to come forward to share their experiences. We shared our training and experiences as doulas and provided relevant data and studies done in other states. 25 states are in some process of implementation or current payment of doula services. And so we have a lot of opportunity to learn from what they've done, and a lot of things started out really poorly executed, and we have the benefit of learning from those now. We found OPR to be thoughtful, thorough, and committed, and believe that the Sunrise study really reflects wonderful work. So just kind of here to say that the Doula Association supports the Sunrise study and hope that you all support that bill this year. Some of you might know, in the United States, we have some of the worst maternal and infant health outcomes as compared to other industrialized countries, and also still the most costly. And doulas are a piece of that has been shown time and time again in multiple studies since 1980. So a doula is ideally part of a team, which would include sometimes a doctor and a midwife, depending on the situation. So we in no way replace a medical provider. We don't do anything medical, as we've spoken to before. It's really about emotional, physical, educational support to families in that process. And there are, as I've already said, about the cost savings as it relates to outcomes. And in Vermont, we have limited access because of the cost prohibition to families, and we are hopeful that more people will become doulas who belong to these priority populations. That's really where we're seeing the worst birth outcomes in the United States, people of color and people living in poverty, and hope that with this kind of certification and reimbursement, we can support people from all different kinds of communities to become doulas. And we have a lot of support from a lot of different avenues in the state right now.
Senator Flex?
What's the well, I have first question, where's the word doula come from?
Oh, well, I think you'll appreciate this because you were just talking about
I looked it up.
Yeah, so it's a Greek word.
It's a Greek word.
Yeah, that means like to serve. Yeah.
And what is the sort of average length of time that a doula, perinatal doula works with a family?
So that varies greatly. In our program, we either get referrals or people come to us, generally sometime 25-ish weeks of pregnancy. Some people it's a lot sooner, especially people who we've worked with before, and they are really certain that they want that support again. And then they're eligible for up to a year postpartum. And so, it's almost hard to even say exactly how much time, because there's just really a lot of time generally put into families. And in my experience, having worked with a number of different families, some who could pay me privately many times over, and some who didn't even have a home. So obviously we're much less resourced, everybody needs a lot of support at that time. That's really a universal need. And people who are under-resourced and dealing with all sorts of life stressors are going to need more. And I think that's why OPR, one of the reasons why OPR set it up in the way that they did as a community-based perinatal doula.
Relevant and options.
Yeah, yeah.
So given the desire to be community-based and serve marginally folks, what's the distribution statewide of doulas? In other words, I'm assuming, maybe incorrectly, that the rural areas might need a little bit more.
Absolutely. That's a, yeah, I mean, as you would expect, there's a really high concentration in Chittenden County. And then there's some in Washington County, some in Addison County, but Washington County and Addison County both have designated agencies that are supporting doulas at this time. So that also contributes to them having more doulas. And then places that are more rural, we don't even know. I think Essex County is considered a maternal health desert. So that I'm sure it's considered a health desert overall. I just know about the maternal part, but and so I imagine that there's not a lot of doulas in there. And one of the things yet
maybe that is where some of the greatest need is, because it is.
Yeah.
It's so sparsely populated.
And one of the works of the Doula Association is trying to prioritize those living in the most rural areas to become doulas, as we are looking at a training that we're rolling out in the spring.
Yeah. So your feeling is that the process to become certified and the fee would not necessarily inhibit someone or dissuade them from becoming a doula?
I don't think so. I mean, there are people who would probably need support with that. And, so that is a consideration. And one of the things that the Doula Association is hoping to do is some secure funding for scholarships for folks to support them for those fees. Yeah.
Anyone else have questions for Maria? Senator White.
I just want to say thank you.
Oh, thank you.
I do think that we are most likely going to consider this bill, and I don't know if we would take it up within the OPR bill or if we would move it as a standalone bill.
We have to stay alone.
Yeah, we have a standalone.
Oh,
That's
no,
the one that we have to
oh.
send back to Health and Welfare.
Okay, so we don't need to eventually include it in OPR in your view? We just.
My view is we need to vote on the certification piece of it and then ship it back to Health and Welfare.
Okay,
With the report of our committee intact,
okay,
and they could go from there and take care of the Medicaid piece.
okay. Well, I would say that I'm wholeheartedly in favor of this, so I really do hope that we move it as a standalone bill.
Senator Whitehouse.
I guess that would be my preference as well. If it was only our committee, I think it would be fine to go to the OPR bill because I have to go somewhere else. I want to send the whole OPR bill to health and welfare. My question for you, so you said that people tend to come in to access doula supports around 25 weeks, but a lot can happen before 25 weeks, particularly when we're talking about preventing preterm birth.
Yeah.
So I guess what's being done to sort of get people in sooner?
Well, in places where we have programs in place, and like in our program at Washington County Mental Health, we work very, very closely with CDMC as an example.
Mm-hmm.
And so we have a really positive relationship with them. And when we're getting referrals from them, they often come a lot sooner because they're able to screen people and know sort of, who's going to qualify, who's going to need the support. So I think that there is an education that other hospitals could benefit from, some of the same kind of education in terms of getting people in sooner, because I've worked in mental health for a really long time, and I know that sometimes day of referral to day of first meeting can be even a month or more, just because people can be difficult to find and other things come up. And so sooner the better, because there is often a delay because of life. So I think that, yeah. And I think that people are really not to get too in the weeds, but we had many grants over the last recent years where we offered free doula services to everybody in Washington County, regardless of income or anything. The only qualifying factor was that they were pregnant. And that was incredibly well received. I honestly could barely even keep up with, that was mostly private insurance. I could barely keep up with the amount of phone calls that I was getting some days. So I think that there is an awareness that has grown a lot, which is very different than it was 15 years ago when I first started. And among providers, a lot of providers are recommending doulas to folks now. And the unfortunate fact is that they're recommending it, but people often can't pay for it. And so there's just been a real growth and awareness especially in the last 5 years. And there's some things that happened during the pandemic that I think triggered that.
And do private insurers cover doulas?
Not in Vermont.
Okay.
In other states, a lot of private insurance have followed Medicaid coverage, but currently in Vermont, that's not a part of this particular initiative.
Well, I also appreciate your work and am wholeheartedly supportive as someone who works with, I'm also a social worker and I work with adolescents,
Yeah.
Emerging adults and children who've experienced like complex developmental trauma. And one of the things that we know from that research is that actually in utero exposure to extreme stress is incredibly damaging to development. And so, when I hear 25 weeks, I'm like, that's great, but I actually want them connecting to you as soon as they know that they're pregnant.
Yeah. Yeah. And we do have some, especially people who are returning to us. Sometimes we're their first call. And so that does happen. Yeah.
Well, thank you.
So I don't have the advantage of having read the Sunrise report, but just to do due diligence, were there any sort of cautionary statements made, or are there people that might want to come in and testify that this isn't a great idea? I'm just trying to cover all the bases here.
There was nothing in the report that stood out to the Doula Association of Vermont or myself personally that seemed questionable or cautionary or unnerving or anything like that. And I think that you'd be very hard pressed to find somebody who wasn't in support of it. Like I said, especially, when I first started this work 15 years ago, it was almost like challenging to really get medical providers to kind of like buy into the concept of doulas. And now it's completely different. Almost any medical OB, midwife, labor and delivery nurse, postpartum support nurse, anybody like that is very in support of doula care. So I really don't see people with that same sort of like hesitation that they had then. I haven't met anyone with that kind of hesitation in the medical field in a long time.
Any other questions for Maria, or anyone else want to offer testimony today?
I just wanted to add to the definition, which is actually it's a term that only started to be used in 1969. And the modern Greek is actually not such a great translation. It's female helper or maidservant. So it's nice to extrapolate it and think about it as a service, which is a happier thought. But it is from the Greek doula, female slave.
Yes.
Just
I wanted to avoid using that word, but
that's my word. I like the idea of being of service.
Suspect some of the services provided by.
Yes, just a bit.
Yes.
So what is interesting, do you see in your experience people being both perinatal doulas and death doulas, or are they so distinct? Because it strikes me that there's an aspect of it that is both ushering in and ushering out that are not dissimilar.
Absolutely.
And so,
and there are doulas who do both.
there
I think it's logistically complicated, just because of being on call and things like that. But there are doulas who are trained, and do practice both.
it strikes me.
I haven't done that doula work, but it is wonderful work and really
very gratifying.
Yeah, beautiful work.
So committee, let me suggest this, that we'll leave this on the agenda for, well, not the agenda necessarily, we'll leave it open for the rest of this week in case there's someone that we are thinking about that might want to come in and express some caution. I don't know
I know
if
the
that's
death
going to
doulas
happen.
may want to join in. I don't know.
The only people I'd want to hear from is OPR, because I still have some outstanding questions for them.
Okay. We
To be
can,
clear, it's not because I'm concerned, I just.
we can certainly have Lauren come in and try to get her in maybe Thursday or Friday. And then my plan would be to vote this out on Tuesday next and send it back to Health and Welfare.
Great.
Hopefully with a 5-0 vote. Thank you for your work.
Thank you so much. Thanks
Yeah.
for letting me speak.
It's been a long time.
Yeah, thank to see you.
Yeah, we were in recovery.
Yes, oh, yes, that's
Yeah.
right, yeah. That is another similar, not dissimilar
Yeah,
relationship in recovery coaching.
Yeah,
And
exactly.
doulas. Yeah, thanks to see you. Thanks for saying that.
nice to see you.
Thanks, Maria.
It's. No.
Thanks, Nolan, and thanks, Jen. Appreciate you.
Sure, no one, was there a fiscal note? I mean, you have the 17 one, but was there a
There was a
fiscal?
fiscal note, but it was how much it would cost OPR to do the Sunrise study.
Got it. So we don't have an updated one on both what it saves, what it projected, what the projected savings are, or the cost.
What I will
Or the
say,
income for OPR.
what I will say is with any program, whether it's smoking cessation or primary care, or whatever, you can't budget for that. All I can do is offer, which I did in the doula. I offered research saying, yes, there's lots of studies that show the long-term effects are there, public health, et cetera, but you can't quantify that. And nor can you book it as a savings in a budget or offset the cost in the first year. But yes, they do have research, empirical evidence suggesting it in the long term, but we just aren't able to book it immediately.
Got it. So I appreciate that, but that's very helpful.
Is there a way, and I realize I'm actually sort of bridging between your role and legislative counsel's role, but you're both standing there. Is there a way to embed in the legislation that savings be tracked so that it can be reinvested into the program? I think a lot of times we do things like smoking cessation, but don't actually ever quantify the cost savings.
I honestly, I think, and I think it's a great question. I think you can direct DIVA to do some kind of 5-year look back on what they estimate the savings would be for the people who use the doula services, what those costs would have been if they hadn't have been. You could do that in retrospect. You could direct them to do that for a report due down the road. That's about the best you could,
Yeah, no, I know your crystal ball doesn't work. I think a lot of times we forget to sort of do the comparison of like the cost of what we're doing now versus making an investment in the future.
Absolutely. And I think that you can direct them to provide you a study of a specific date with what you want to look for. And I think that's totally appropriate.
Maria, did you want to add something?
Well, I wanted to share with you because you asked specifically about long-term cost savings. We are actually doing a study right now. And we've had 50 participants interview style, been IRB certified by AHS. Then it's finishing up, so I don't have anything like super concrete right yet. But I can say that of the 50 people that were interviewed, and it was a mix of Medicaid recipients and private insurance and a mix of different need levels, but we had 0 that had any DCF involvement.
Wow.
And that was really that. So that is, and that's just here in Washington County. So that's a very local, and it's just in the last few years. It's very relevant, but that is a big cost savings right there. In terms of
savings too.
yeah, so there's a lot of savings in that, but
What do you mean, no DCF involvement?
so they had no.
Because they oversee also the office.
You're right. That I should clarify.
Economic
When we say
opportunity. So
DCF,
Actually, to me, that says
yeah.
that poor people weren't accessing it.
So when we say, and you're absolutely right, I'm using like the wrong terminology. When we say DCF in the mental health world, generally we're referring to Department of Children and Families, Child Protective Services. So, I should have been clear what I meant, because no, it doesn't mean economic services. It means child protective services. So, that is a really substantial cost savings. Not to mention trauma savings, all sorts of different things. But, I wanted to mention that to you because you had asked about long term.
No, I really appreciate that. And I'd love to see that.
Yeah.
And
I'm happy to share
comparisons to like a similar population
Yeah.
that didn't have those services.
Yes.
I think that's the only way we can even start to.
I know. Yeah.
Okay, so for those of you that may view this later on YouTube or whatever, if you have something to add to this bill in terms of our jurisdictional piece of it, please write to Jillian and let her know, or me, and we'll certainly take more testimony. We will have Lauren Hibberton to answer some of the opioid questions that Senator May asked. So again, thank you. We're hoping to
Thank
vote
you so
this out
much.
soon.
Thank you.
Thanks, that was great.
Let's move to our final witness of the day.
Thank you.
Michael Vaughn is going to join us again. He's with the Vermont Educational and Health Buildings Financing Agency. That's quite a mouthful. And wants to change the board structure. Welcome again, Michael. I think, have seen you once before this year.
Aren't you?
Great.
He's our
I'm
municipal guy.
Yeah.
I'm wearing a different hat today. Believe it or not, it's Vermont, so you have to do a couple things. For the record, I am Michael Gahn. I am the executive director of both the Vermont Bond Bank and the Vermont Educational and Health Buildings Financing Agency, what we call VEVFA. And I'm here to speak about VEVFA specifically with a request for some modernization.
Wow.
So I'm going to share my screen if that's okay, or I guess that's not turned on. I'm happy to do it either way.
We have a printed piece too.
Great. I'll direct you through some slides here. So on page 2, this is going to get a little complicated, so just hang with me for 5 minutes and this will all make more sense. So much like the bond bank, VEVFA helps facilitate access to tax-exempt financing. But unlike the bond bank, which works with municipalities and school districts, VEVFA works with nonprofit health and educational borrowers like Rutland Regional Medical Center, North Country, St. Johnsbury Academy, Linden Institute, Middlebury College, UVM Medical Center, the educational and health anchors of Vermont. To access tax-exempt debt as a nonprofit. Yep, go ahead, I'm sorry.
Do they work with public schools or only private schools?
Bond Bank works with public schools. VEVFA works with the nonprofit schools, the independent schools. So to access tax-exempt debt, which is allowed for nonprofits across the country, you have to issue your bonds through a governmental issuer, a governmental authority. And so VEVFA serves that purpose for health and education financing institutions. It benefits from a category of tax-exempt bonds called private activity bonds, which is also includes things like housing, waste management, student loans, but unlike housing or student loans, it's not subject to what's called volume cap. So it's sort of unrestricted in terms of how much you can issue, so long as you have the governmental issuer there to help you. And I guess just as a tangential point, in Congress right now, private activity bonds are very much at risk. The CBO scores those at about 150 billion worth of savings over the next 10 years. So our trade organization, as well as others in the housing space, are working hard to try and preserve that tax exemption. But that's kind of an aside to this conversation. So this agency, you see there on the right who we work with and the amount outstanding. I think what's notable from a public policy perspective is how these institutions are anchors of small communities that wouldn't exist in the same way without those institutions, and without those institutions being financially viable as well. So like I said, the nonprofit works through the government issuer. The government issuer approves the transaction, and also via some tax requirements at the federal level, the governor approves the transactions as well as the highest ranking official in the state. The VEVFA bears no financial liability for all of the transactions you see on the right. Those are 100% pass-through. So the borrowers have all the financial liability. The VEVFA is just there to facilitate the access to tax-exempt financing. Okay, that was a very quick lesson in what's called conduit bond financing. I assume none of you have any questions because you're so astute, but if there are any questions, I'll stop right here.
I think we're fine, or maybe not.
No, I'm just curious when it was founded, because it says you facilitated over 3.5 billion in financing over the history. And if it's 922 million as of 24.
1966.
So yeah, it's been around for a while.
Yeah. Similar organizations exist in every state.
Ah, okay.
This is the mechanics of how it works in terms of the pass-through transaction, but I'm going to skip that for the time being. That's for those of you that are more interested. Here's a case study, Middlebury College, my alma mater. We've done a number of transactions with them, and this is a particularly meaningful one from March 2020, when we were able to work with them to help with their capital plan. And here's kind of here's how my work at the bond bank relates to my work with VEPFA. We share an executive director, me. We also share staff that's codified through a memorandum of agreement between the two agencies, but we have separate boards. And whereas the bond bank meets bi-monthly, sometimes more, VEPFA meets on an ad hoc basis as applications for financing come in from folks like St. Mike's or one of the hospitals. That board has 13 members. 7 of them are appointed by the governor for 6-year terms. Those gubernatorial appointments appoint 2 more members who have 2-year terms. And then there are 4 ex officio members, including the state treasurer and various administration secretaries. So what I'm coming here to you all with the request for is help in some legislative changes starting on page 4 to reduce the number of board members. It's quite unwieldy to have a 13-member board when you only meet a couple times a year, and we are not immune from Vermont's challenges in terms of recruitment of new members for volunteer positions on governing bodies, and this would make it quite a bit easier for us, and I think would get us to function more efficiently. And in practicality, our finance committee, which meets quarterly, does a lot of the heavy lifting for the organization. So it just sort of codified that. So what and we have proposed legislation. I have to admit, we're still, this meeting came up, we were able to schedule this very quickly, and so haven't come quite to a conclusion on the number of members, but it'd either be 6 or 7. I know, boards like to have odd numbers. So we're working through that, but the idea would be that we would have either 4 or 5 gubernatorially appointed board members, and then 2 ex officios, the state treasurer, who's currently ex officio, and the secretary of administration, who is currently ex officio, but then in the chance they wanted to, the administration wanted to tap the expertise of, say, Health and Human Services or education, they could do so by delegating that representative as they do now. So that would just streamline our organization and be incredibly helpful. We've had instances where we missed a quorum because our board is so large, and we have to get 7 members rather to be there at the same date and time, and sometimes that proves extremely difficult. Since we're at it, we have one more request in that the bond bank has had a lot of success in leveraging our relationships for accessing low-cost capital. In particular, we have some really great success stories in the energy efficiency space. And we would like to leverage those bond bank relationships on the VEPFA side by creating some special programs this is built around energy efficiency, but it might be other things, to help with the financial sustainability of these anchor institutions that we work with. I think you all are aware our rural hospitals are challenged. And same thing with our higher education institutions as well. And so we're looking for any and all things to help make them more fiscally sustainable, and energy efficiency improvements on their aging plants is something we believe to be important. We have undertaken a study over the past few months and isolating the educational sector, estimate there's around 23 million in ready to go projects. So anyway, the conclusion from this is that right now VEPFA doesn't have the ability to do direct lending. We can only do so on a conduit basis, on a pass-through basis. And so we'd like some changes to our statute to allow us to do direct lending as well for really special niche things where we can leverage the bond bank's national relationships and bring more low-cost dollars back here to Vermont. So those are the asks. And we have, as I mentioned, I need to take another look at it, but we have some red lines to our statute.
Senator Boyowski.
So the Vermont Bond Bank covers a broader scope than this board, yes?
Yeah, the bond bank is just under statute. Our authority is only with units of government, and whereas VEPA is nonprofit educational and health institutions.
Okay, so I certainly appreciate that the 13-member board appointed in the manner that it is a lot. But I'm a little hesitant to remove the sort of subject matter experts of healthcare and education. And so I wonder, as I'm looking at this, if it might make sense or be amenable to think about the four gubernatorial appointments like the bond bank, eliminating the 2 members appointed by the appointments, and then having the treasurer, secretary of education, and secretary of human services.
Yeah, I think where we were thinking is that doesn't save us a lot on logistical complications. And with the Secretary of Administration being the ex officio, if there is that subject matter expertise needed, they can, right now the secretary delegates, and so do the secretaries of the other organizations, and we'd expect them to do the same, and bring in the expertise that's needed. And I should mention, nothing that VEPA does can be done without the requisite approval. So in the healthcare sector, that would be the certificates of need, and things of the like. And we also work with a financial advisor who we have a statute in which we have to certify as to the feasibility of the financing, which is a bit different from other states. And so we have a financial advisor who sort of writes that third-party opinion for us.
I appreciate that. I mean, the proposal I just put forward does still cut you down to a 7-member board. And the challenge I have with having it be a much broader person to tap the right expert is you don't know what you don't know. If you're not a subject matter expert, you don't necessarily know that you need a subject matter expert.
Yeah, I can appreciate that. I think what you have then is you have a near majority of administration officials on the board, and the board is hesitant to move to that structure.
I guess I'm curious how that's any different than the structure you proposed. If 4 members are appointed by the governor, and then you have the treasurer and the secretary of the administration, you have 1 member that's not an executive, either staff member or appointee.
Yeah, those appointments are would be proposed to be for 3 years. They're currently for 6 years, so there's no there's quite a bit of diversity in those appointments.
Senator Clarkson.
Well, that is helpful to hear that there is a range of terms. I guess my big problem with this is that these are all appointed by the governor,
Yes.
except for one person who's elected by the public.
But that was my point, is like neither my proposal or the proposal to go forward is not heavy on the administrative.
Yeah, I mean, they're appointed, yeah. So,
I hear that. I don't think that's unique to our board, though. You know, the bond bank has 4 gubernatorial appointments, and the treasurer sits ex officio. It seems quite similar.
Yes, and I don't like that either. I would actually propose we expand that to include less.
yeah, I mean, it's yeah. Anyway, I just have trouble with non-experts being on a board and a bunch of appointees, and I would hope always that the appointee be thoughtfully chosen. I think the process is pretty thoughtful for some of this, but some of it is, you know, I think it's probably a range. So anyway, I can't imagine anyone wanting to serve on either of these boards if they weren't keenly interested in you know, forms of financing and finance experts, but you know, you never know who gets appointed to these things.
Michael, can you tell us who currently is on the board?
Thank you. That'd be helpful.
Basically.
Yes. We do have a couple of vacancies right now because of the challenges that I've described.
Yep.
And it's not that I don't know my board members. I don't want to leave anybody out, so bear with me here.
Sure.
Yeah, I mean, like, to not, on the Vermont Bond Council, to not have a member of the LCT is just bizarre to me, given that you do most of municipal bonding.
Again, when I look,
Yes.
I have concerns with the makeup of both boards.
Yeah, no, I agree with you. I think it's bizarre. I think it's odd.
Yeah, I mean, it's the structure replicates what other agencies do nationally. Keep in mind, in both instances, we are providing access to credit. So as much as is possible with a public entity, providing safeguards around political influence is part of the dynamic that's underplay, and is part of the reason nationally agencies and authorities have similar structures. So our board chair is Fritz Burkhardt, who's a finance professor. Ken Lindsley, who's has a lot of community involvement in Danville. Anita Bourgeois, who is a banker in the public finance space. Lauren Wabi, who is a former CFO of Norwich University. Ken Gibbons, who is a former banker, and Mario Hankerson, who is a lawyer. And then we have Neil Robinson, the former CFO of St. Mike's University, as a board appointment. And then the current designees for the ex officios are Scott Baker from the Treasurer's Office, Sean Casino from the Education Department, Peter Muino from Agency or Secretary of Human Services, and then Sean Brown from the Agency of Administration.
Okay. Well, we appreciate your coming to us with this. Do you have proposed language?
Let me points taken here. Let me do some thinking about the structure and see if, given the comments I've received, if we would in fact have some operational efficiency, and then we'll follow up with the committee after I've been able to deliberate there.
Okay.
Good.
Are there any other questions from Michael? Okay, I'm sorry.
Yeah, just to clarify, on the bond bank, Michael, aren't you primarily, I mean, it's often referred to as the municipal bond bank. You do more than municipal projects, right?
Yeah, that's in fact why we dropped municipal, because we were working with school districts in particular, are a huge part of what we do. And so we felt
But
like
they're
that was
municipalities. They are technically municipalities.
right under statute, right? Yeah, any unit of government.
So, yeah, anyway, it is sort of, I mean, I'm sure on your board, you have some municipal people, yes?
On our bond bank board?
Yeah, on the bond, do you have like Ted Brady, the head of VLCT, does he serve on it?
No, VLCT hasn't. I mean, obviously, they're a close partner, but they are a membership organization and we are extending credit. And so that's, there are some guardrails around that.
Yes, got it. Yeah, okay, thank you. It's always interesting to learn what exists in this state that we didn't know about 2 days ago.
There you go. Another best kept secret. Well, good. Well, thank you so much for your time.
Thank you.
Thanks, Michael.
And is there a time frame on this that you're hoping? Did you ask?
When would we need to have it?
Yeah, what's your time frame on this? What is the terms, when the terms start or end?
We're very flexible. I mean, this is definitely something that's become more acute recently with every select board in the state, every agency in the state, is particularly when you have something that isn't meeting on a regular basis, having recruitment issues. So we don't exactly. We're very flexible. In other words, this would be nice to have, but isn't dire, I suppose.
Great, thank you.
Thanks, Michael. We appreciate your time.
Thank you. Appreciate it.
Take care. So we will give this due consideration. I'm not quite sure if maybe I should have asked Michael before he left. If I was just appointed and then we change it, does that mean I lose the other 5 years? Because it's a 6-year term.
Right, well, it depends on what straw you draw, who gets.
Well, I think you could also, and we've done this in other boards before too, you create a structure by which, say, the person who serves the longest transitions off, and like you create transition protocols so that doesn't happen.
So this doesn't necessarily mean that it will happen next year. Yeah. Okay. Well, as I said, well, certainly think about it.
Yes, and we have no bill on it, it would be part of the committee bill.
Yeah, I don't think there's any bill. It didn't seem like he had language, so. I don't think there's any drafting going.
So someone is rush. So we could ask Kim for language.
I think I did.
Okay, then you did.
Yeah, that's, I picked on them.
Then we are.
You picked up what Senator Palmer was putting down?
Yeah.
Right, sorry.
Okay, but yeah, I would definitely, think we could get 53. This is back to the duos.
Yeah, let's move on.
I don't think I can imagine that there's someone that's out there that's all of a sudden gonna say, what a horrible idea that is.
Midwives, the only other, not to say it's online or
Oh.
call out midwives, but that would be the only group I could see that would maybe have concerns.
Possibly, I guess.
That was,
They-
well, I was trying to
Like
think,
the
like, you know,
work
it's the
together, yeah.
optometrist versus the ophthalmologist,
Yeah.
like who's the higher, more certified or registered group in this?
They do exist in the same universe right now,
Yeah.
but
Or
they work
nurses,
together.
I don't know. Yeah, no, I think they do work together, but if we're trying to think of the universe of people who would be in opposition, that's like the closest I can think of.
that's a very good idea, actually. If there is such a thing as the Vermont Midwife Association,
Yes.
I believe there is.
maybe we should invite them at least to weigh in on this.
Yeah,
I'm not looking to
yeah, and I don't
rail
think they
this
don't.
either.
They'll probably come in.
We have Laura, and we have.
They've been in our committee, no, thank you. They've been in our committee in the mornings,
The midwives?
And what have they said?
that they were in favor of all this.
Oh.
And they're also in favor of the birthing centers, the new.
Oh,
birthing
the
centers.
freestanding.
So you've taken testimony on specifically S 53?
Yep.
Okay. Well, that's good to know. No, thanks.
Allison chocolate,
No thanks, I'm just.
okay.
Okay, tomorrow. We will. Just in case you all are read ahead.
Yes,
Open meeting law, so. We have
we have a lot of people who
requests
want exemption.
from six entities, I think, that wanted to have some carve outs. It could be an interesting discussion. But we'll have Tucker and Ruth in on that, and maybe we have specific questions for, both of those folks in terms of, and I did print out, Allison, let me just see if I can find it quickly. Your list. So, VHFA, Vermont State Housing Authority, Vermont Housing and Conservation Board, Vermont Economic Development Authority, Vermont League of Cities and Towns. Those all have at least an interest in the open meeting law and its implications. This person, Chad Simmons,
Chad Simmons, the VHFA.
yeah, mentioned that again, if we go back to the advisory and non-advisory bodies, maybe we need to refine those definitions because they're having trouble. It's our understanding that the intent was not to include agencies such as ours in meeting the hybrid recording and posting requirements because it makes it difficult, if not impossible, to do board retreats or off-site visits as we've done in years past. And,
We don't.
yeah, so, yes,
So it was always our intent, based on my recollection of the committee discussion last year, for them as budgetary organizations to be included in the hybrid requirement. However, it was our intent to include a carve out for site visits, which in all of the back and forth got left out.
Absolutely.
And so I don't know that the necessary, the categorization that they shouldn't have been included in that hybrid requirement is true, but there should be a carve out so that site visits are allowable.
okay,
And Tucker and I have talked about this, and he has the language that was originally in the bill that somehow between the many versions in here and the many versions in the house got left on the cutting room floor that we could put back in.
Okay,
But I don't know, and I'll only speak for myself now, I will no longer characterize the conversation from last year, but I don't know that I would be comfortable moving forward with that list of people not being considered non-advisory.
Say that not being considered non-advisory.
So they're currently considered non-advisory and they're asking to be considered just advisory where they could meet fully
And
remotely
you're
or fully
saying
in person.
you're not.
I don't want to change the definition to not include them.
That is,
So I want the definition that makes them subject to the hybrid open meeting law to remain the same.
I agree with you.
Yes,
Okay,
I want to give them a carve out so that they may do site visits, because that was our intent.
Right, our intent was always that site visits would be fun.
okay, yes, I am in agreement with you. Now, there was some double.
Yes, I know,
negatives in
because
there
of
that I
the
was
way
like-
the definition got done, that non-advisory
Yeah.
is actually the more impactful board that's got budgetary and lawmaking ability and all,
Yeah.
and quasi judicial ability, but it's the non-advisory board, so that's really tricky.
Yeah.
so if I'm on my local Vermont or Rutland Cemetery Commission,
You can meet how you choose. You can meet fully remotely, you don't have to be hybrid.
but we're still under the open meeting.
No, yes, but you don't have to, because if you have a budget request, you probably, unless you're a private nonprofit, which means you're not subject to it anyway, you, if you are a creature of the town, of the municipality, you are probably advisory. And your budget is passed by the select board, which is non-advisory. They are the ones making budget decisions. So your meetings would all be fine to be not
Hybrid.
hybrid.
They can be fully remote, they can be fully in person. They still have to be warned, they still have to, but they don't meet that budgetary quasi judicial.
Okay,
Even the school board budget subcommittee is considered advisory because they don't themselves vote on the budget. They recommend it to the school board.
Right. But if most of our cemetery, I would say, well, I don't know, maybe 50-50, but most of our cemetery commissions are.
I just use it as an example.
Yeah. But our parks
Most
commission,
people
we,
really, to be frank, care about one way or another, whether they're.
but our parks commission, had been functioning without.
using?
The Gardens Club was my example.
But I don't like that.
Garden
because
Mine was like the Hartford Garden Friends. It was like, I don't want the Hartford Garden Friends to have to set up a Zoom meeting every time they want to talk about something.
But they aren't creatures of the.
They are. In
That
Hartford,
was-
they are.
That was
They're
the
like the
issue.
only one, most of them are private.
This was our example, but they ended
But-
up to
Yes.
being advisory and not non-advisory.
Isn't it confusing? Maybe that's what needs to
Well-
change.
I
So
really-
they-
I agree with that.
The three of you had the advantage of chewing this up last year.
Yes.
And when Senator Hardy comes in, the only members missing are Ann Watson and Bob Norris.
Yeah.
So,
Get them in for.
We'll pull
well, I'm not sure we don't need to do that. I just want to get to a place where everybody sort of goes, yeah, that makes sense.
And some of the things the LURB brought up
Mm,
that their concerns are categorically not true. And that's why I think it's helpful to have Tucker in to hopefully has had a chance to look over what they said and be able to weigh in from his expert space of this is actually what the law does. Because I think there's also some misunderstanding about what the law actually does.
I think that's.
So we will, well, first we gotta, elect in the joint session,
Oh, it's not tomorrow.
yeah, Sergeant at Arms and UVM.
That's
trustee.
neat.
Then we'll take 59 up, and that could take a good hour, and
Yeah,
we
we-
allowed that.
5 people.
58 is, to be frank, one that I'm probably not gonna, put the accelerator down on. This is the one that has, pay plans of certain law
Gotcha.
enforcement officers and firefighters employed by the state to be able to get to a certain compensation level faster, if you will. And the sponsor, I've already told him that it probably will stay right there for, the remainder of the month at least, maybe next month too.
Okay.
And then we've got our first crack at the, again, forgive me for calling it the I bill,
No,
but, S64. Jen will be back in, Jen Carvey. You are going to hopefully tee it up for us.
oh, I'm
You're-
happy to do that, yeah.
You're the sponsor, and I think, how many of us, I signed on to it.
I
We
can't remember
sponsored
if I did
it
or
last
not.
by any.
Did I?
Did you sign?
I can't remember, but I'm not opposed to it.
Okay. And later, so it could get a 5-0 vote, and, be back into Senate Health and Welfare. Now, I did ask John Bloomer, because you asked me a really good question when we were meeting, I think it was when we were setting up the agenda for next week. What does a committee of jurisdiction exactly mean and who is it? And his answer was you both are. So she's referred it to us. We're going to do some work on it, take some testimony, pro and con. It'll probably take at least a week. And then we send it back to Health and Welfare. And at that point, they also are the committee of jurisdiction. The motion that I'll make is that they accept our work on it, or the committee's report intact. But to be fair, and John said this, they can change it if they want. And then it goes to the floor as their bill, if you will. But we both have jurisdictional tentacles on it. So I'm not sure how that'll, and I did talk to Senator Lyons. She's not sure she's going to be able to get that bill out for process.
Well, that's my concern, is because and so I wonder, and I can talk to John about this, if there's procedurally a way in which we bring it to the floor ahead of crossover and then send it to them, so it's cleared crossover.
Ask
You see,
John.
I'm gonna ask
I heard you before. I ask John.
Okay.
I don't think it gets us around the rule, and I
Because it
think
did
there's
with
going to
committee.
be.
Last year it did with committee bills, when we were able to introduce them on the floor and then refer them to another committee, they were saved from crossover. So I'll ask John.
The only thing is we may have a little bit of
Sorry.
with how it would, we'll see what leeway we get, because there may be something.
And I have a feeling that Senator Lyons would not see that as a very good thing to do, because we promised to send it back to her.
But
Oh, I just want to know procedurally if there's a way to save it
Okay.
from crossover, not to not give it to, I want Health and
There-
Welfare to get it.
I want,
But I don't want to jeopardize it not getting out either.
Me too. That's why I'm trying to figure out if there's a procedural way.
and I think we may have, that may be, okay, we may be okay this year. We may get some leeway. I'm hoping,
Wow. I
because
think on some
I have a bunch
things
of
we may,
bills that.
and some of us may.
And then don't forget Friday, we're back in the house.
And are we doing something
Yeah.
after that, or just,
No, I'm not planning on to. We have 2 hours set
what
aside.
are we doing with our AI bill?
Monday or Tuesday, I guess.
When, because I'm hoping we're gonna get it out.
I know. That's 23, right?
Yeah.
Yeah. So we're gonna have, Jillian's gonna get a hold of the Attorney General to come in and testify on that. I know there are people that are sitting around the table that have very different feelings about this. I'd like to get to a point where if we're going to do carve out for anyone, that it makes sense to everybody why we're doing what we're doing. I think the Vermont Association of Broadcasters is a little different position than Facebook.
Yes,
But
I would agree.
we've had requests from both to say, hey, wait a minute, we don't want to, and so I don't want to pass something that is going to encourage people to start filing suit against the state either.
No.
Oh, that, I don't think that's gonna happen.
But anyway, we're going to hear from the Attorney General on Tuesday. And if there's been consensus among a carve out for certain people, we'll take that up. Again, I don't want to necessarily hold the bill up. It may be 4-1 vote, it might be 3-2, I don't know. I wish that we could just hold the person responsible for doing it. And not have to
What
worry.
if it's a country?
Exactly.
What happens?
Also, I spoke to Senator
Or a
Welch's
party.
office and they're gonna get us their language today.
Oh, good.
Yeah, Senator Welch, because they're working at this at the federal
Oh,
level on a
right.
full prohibition. And so I spoke
You forgetting.
from that one from Ryan, Hattiesburg.
Oh, right,
So we technically have next week and the week that we come back after break
correct.
to get 23 out. So we do have a couple of weeks left on that. I guess that's it.
Great.
Anybody else have anything?
Oh, many things, but they aren't necessarily SGO.